Hello, everyone, and welcome to CR Arthritis 2025. My name is Ellen, and I'm the Programs Coordinator at Arthritis Consumer Experts. Today, I'm joined by Dr. Berard, who is an Associate Professor of Paediatrics at Western University and the Division Director of Paediatric Rheumatology at the Children's Hospital, London Health Science Centre in London, Ontario. She has extensive experience in clinical care of patients with juvenile idiopathic arthritis and uveitis, as well as research expertise in longitudinal data analysis and cohort studies. We will clarify what everything means as we go on in our interview. As well, Dr. Berard will be presenting at the abstract workshop session, so a new format on the topic of how common is arthritis in inflammatory bowel disease patients, and this was done using administrative data in Ontario. So welcome, Dr. Berard, and thank you for joining us today.
Thank you very much for having me.
Dr. Berard, could you tell us a little bit more about yourself, how you're involved in rheumatology, and how you came upon this project?
Great. So as you noted, I'm a pediatric rheumatologist in London. So majority of my practice is around kids with juvenile arthritis. But of course, we see lots of varied patients with joint complaints. And I think for a number of years now, I have really noticed patients with inflammatory bowel disease suffering with joint complaints and arthritis, sometimes of their peripheral joints or of their spine. And I really have identified this population to have like an unmet need. So I think that they're late to get to me, and I've had interest in this for a number of years, and I'm very fortunate because I have in the last 3-4 years have a collaborator in London who's a pediatric gastroenterologist, and she's also very interested in this topic. So it's really, we have a number of projects on the go, and we're just very excited about the work that we're doing. So even in the inflammatory bowel disease world, they've very much recognized that arthritis and other extraintestinal manifestations of inflammatory bowel disease are under-recognized and underreported, and that patients are suffering, that they have, effects on their quality of life and their physical functioning, and it's really an unmet need in their field. So I'm so happy to have a collaborator that we can sort of move research forward in this area.
It's really like a collaborator who's also experiencing these issues and seeing these similarities and has the expertise, and it's gastroenterology meets rheumatology. And I think more of our conditions need this kind of collaboration in arthritis because these symptoms or these conditions are so common, right?
So common. So I think, what I've really learned is that in Canada, we have such a high rate of inflammatory bowel disease, and it's actually increasing. And the Crohn's Colitis Canada put out an impact report every couple of years, and they've identified that by the year 2030, 1 in 100 Canadians will have inflammatory bowel disease. And in fact, the most rapidly growing group is actually the pediatric onset cases, which of course is my area of interest as well. But just understanding the burden of inflammatory bowel disease. And then, of course, from our research, this particular abstract, we're learning that the prevalence of inflammatory arthritis is rising. When we looked at administrative data from 2003 to 2019, the prevalence is rising, and it's rising most quickly in patients over the age of 65. So we found, that there it's, 20% of those patients. And so it's increasing, and with IBD going up, it's going to only increase further. So it's very timely, this research, I think, to inform patients and care providers, because patients that have both inflammatory bowel disease and inflammatory arthritis, they need expertise to be able to manage the inflammatory arthritis in the context of also having inflammatory bowel disease.
Absolutely, because I think, as somebody living with inflammatory arthritis, sometimes you just don't know that one of your symptoms is related to another. You're just like, oh, well, no, this affects me. It's like, no, these are systemic conditions that could not affect anything, but take your pick at this point. Like we don't know how it will manifest in each person, and it's so unique. But you're seeing these trends again, referring back to your expertise in longitudinal data analysis for our listeners. Longitude data analysis, where you take administrative data. So these are, correct me if I'm wrong, Dr. Berard, medical records, charts from hospitals, and you're able to look back at them to look at and find these trends. Is that what you're using for your data?
Yes, so administrative data in Ontario is housed at the Institute for Clinical Evaluative Sciences in Toronto, and it's using data that's collected as part of routine healthcare. So it's some patient demographics, their hospital visits, their procedures, their inpatient hospital records. So you can use that data to look at population trends and like incidence and prevalence, but also like healthcare utilization. So with this, what we started with is there's a very well established cohort in Ontario, the Ontario Crohn's and Colitis cohort. So it's they've identified using algorithms with high accuracy to figure out who in Ontario with billing codes have inflammatory bowel disease. So we took that cohort of patients and then we looked year over year at the billing codes for inflammatory arthritis to try to identify patients that have both inflammatory arthritis and inflammatory bowel disease. So we're just looking at that year over year over like the 19 years of data that we had. And definitely there is a rising prevalence, particularly, as I mentioned, for this over 65-year age group. So yeah, that's what we've done so far. There's a number of aims to this research project with my colleague and our collaborators. The first step was just actually quantifying like what is happening over time with how many patients have arthritis and inflammatory bowel disease. I wanted to touch on something you said before as well. I think a big part of this in speaking with my GI colleague is that, systematically gastroenterologists, they focus on the bowel disease and the treatments for that. And not always are they asking about joints, asking about skin, asking about eyes, or like educating their patients. Like they're focusing on the bowels, and that those patients are very, very sick with their bowel disease. But now just with this focus on these extraintestinal manifestations and educating patients so that they can advocate for themselves, so they can bring up to their care providers, I'm having joint pain, or whatever's going on with them, so that they can get the care that they need. So it's like educating providers and also educating patients. But then like together with gastroenterology, we need to come up with a better way to systematically assess and diagnose these patients early so that we can mitigate suffering, but also start appropriate treatments and like minimize complications. I mean, this is all down the road, but I think it's very important, especially knowing how much there's like increase in prevalence of IBD, right? So it's just going to become only an increasing problem. So
Absolutely.
we really need to work together and have like joined immune-mediated inflammatory disease clinics where you have like rheumatology and GI ideally working together in a clinic to like take best care for patients, right? So that's hard with the limited number of rheumatologists, but I mean, it's a dream anyway.
It sounds like an excellent standard of care and something we should strive towards. But I am curious, Dr. Berard, what are some of the findings, if I can ask? Otherwise, then we know that the prevalence is increasing from your administrative data analysis. What are some of the other findings that perhaps you'll be presenting as a part of the abstract workshop session?
Yeah, so what we basically found first off is that clearly over the years of the study period that IBD itself increased, to no surprise. So, there was 54,000 people in 2003 and 110 in 2020 living with inflammatory bowel disease. And overall arthritis increased from 7% to 15% over the 16 years. Then more specifically, as I mentioned, 23% prevalence of inflammatory arthritis in people over the age of 65 that also have inflammatory bowel disease. But then we looked a little bit more to see at if Crohn's versus ulcerative colitis, females versus males, and then and so basically we also found that Crohn's disease patients have slightly more inflammatory arthritis than ulcerative colitis, which is what we would know from other research studies, but it's also we found that using administrative data. And then we found that inflammatory arthritis was slightly more common in females than males. Then separately, we also looked at all-cause musculoskeletal visits to doctors year over year. So we looked each year at a time. So some patients will have joint pain, back pain, tendon swelling, other like non-specific findings. They don't get the billing code for inflammatory arthritis. So we wanted to actually look for inflammatory bowel disease patients, other reasons musculoskeletal related, not trauma related, that they were presenting for healthcare. And so we found that overall, the musculoskeletal related encounters stayed pretty stable year over year for the 16 years, but we did find a slight increase in visits for MSK complaints in the under 18 population. So we have to look a little bit more into that. We also found for non-specific musculoskeletal complaints, slightly more common amongst females. And we didn't find any difference between ulcerative colitis and Crohn's disease for that purpose. So those were the main sort of findings from this initial study, but this is also the first population level estimates of inflammatory arthritis and musculoskeletal like related conditions in people with IBD. Certainly in Ontario, this is the first in pediatrics with pediatric data ever, and also there's very few studies done in adult IBD as well. So just using administrative data. So
I'm just so surprised that this is, and I'm so grateful that this is the first study, but very, very surprised that this is, the first study looking at the intersection of these two conditions. And I know that this year's meeting theme is Ascending to New Heights, Peaks of Innovation in Rheumatology. I think your work fits very well into this theme. But what are you looking forward to implementing in your field of work? I realize we've just completed this administrative data review. What are maybe some next steps?
So with this work, we're after we've sort of done a prevalence study, we're now looking to sort of look at healthcare costs associated with having both inflammatory bowel disease and inflammatory arthritis, and looking for the healthcare costs and visits that those patients have, comparing to just having inflammatory bowel disease alone. Just trying to capture the burden on the patients and obviously cost to the healthcare system as well. So that's sort of the next step with that. Separately, I think there needs to be work focusing on early diagnosis, screening of inflammatory bowel disease patients so they can actually get properly assessed by rheumatology and get the care that they need, be it medications, be it physiotherapy, be it exercise programs, like just increasing awareness so patients know to advocate for themselves, but also that we as healthcare providers help people get diagnosed and treated sooner to try to limit their morbidity. So, I think like my colleague and I, so Dr. Crowley is her name, we also are looking at some other aspects of the extraintestinal manifestation of the musculoskeletal extraintestinal manifestations. So we're looking at some imaging. We have a study looking at imaging, MR imaging, looking at the sacroiliac joints. We're looking at a bit about nutritional status in patients that have musculoskeletal disease associated with their Crohn's versus just Crohn's alone. So we have a couple of projects on the go, but certainly I think just gathering this information at the population level will be really helpful to like inform patients, care providers, policymakers, like just with the rising prevalence of inflammatory bowel disease and the care that they would need with a concurrent arthritis. I think we just need more expertise, more rheumatologists, more physiotherapists, like just people to help care for these patients, which ultimately, if we get to them earlier, limit morbidity, it will ultimately save costs to the healthcare system, but also will ideally, hopefully improve patients' quality of life. So I think this is just the starting steps, but I think there's a lot of work to be done in this field. And I know there's a lot of interest from the IBD world and Crohn's Colitis Canada. Like this is a very big focus now for them, is the extraintestinal manifestations of inflammatory bowel disease and the burden that that has on patients. And it's very much an unmet need. And I think, there are certainly more papers coming out all the time in the adult world, specifically looking at rheumatology and GI working together to help more like move this field along, because it's very important, I think.
Very, very important, very prevalent, as you pointed out. Now, on the topic of advocacy, do you have any other insights you would like to share to help improve a patient's disease journey, their self-care, or any tips for advocacy? So say I'm a patient living with Crohn's and I'm experiencing some outside of the colon manifestations. What steps should I take?
Yeah, so definitely that patients need to bring that to the healthcare providers and not to just ignore it, or just, as you say, like patients don't always know what's part of their disease and what's separate. And I think just, through Crohn's and Colitis Canada, sharing this information for IBD patients, but also partnering with Cassie and friends, for example, in the pediatric world, just so that we can actually get this out to patients and their families so that they know to advocate as well for themselves. But also just sharing this information with rheumatologists and gastroenterologists, and ideally one day sort of policy people, to kind of leverage all of that so we can increase awareness and then increase funding towards this area. So I think, I think educating patients is so powerful, because with this knowledge, they can speak for themselves, which is going to get hopefully them to care faster than these other avenues. But definitely we need to help patients with this knowledge so that they can move their care forward too. Yeah.
Incredible insights that I will personally take away, and I hope anyone who's listening will take away, and that maybe you'll share this episode with someone that may be experiencing symptoms. But with that, Dr. Berard, thank you so much for your time. Incredibly relevant work, very timely work with the exponential increase in the prevalence of Crohn's disease. And thank you for meeting us on your busy evening.
Thank you so much.
And with that, thank you to our audience for tuning in. Remember to check out our other episodes from CR Arthritis 2025. And with that, I wish everyone a wonderful rest of the week. Goodbye for now.